don't you start?
Well, you know how when people first meet each other and fall in love, they say things like, one reason I fell in love with him was because I could just totally be myself. I felt totally accepted, and it just seemed easy. And then, of course, what happens is it becomes really hard. You think, I should probably be anyone but myself, and you no longer feel accepted just for being you. How does that happen?
I don't know.
Well, you better know, because we have to help people with their relationships. They're depending on us.
Well, let's talk a little bit about what we do. We do what's called marital retreat. And with marital retreat, couples come to Monterey, Carmel area, and they work on their relationship. And there's 3 reasons why we think that working on your relationship in a retreat is a good idea. First is that when you're doing your work locally, what you find is that you go to your therapist and it's 1 step forward and 3 steps backwards. And you know, you have a fight during the week, you start discussing it, and by the end of the session you're mad at each other again. The second thing is that you're under so much stress from work and from kids and time constraints that you really don't get a chance to be together and practice any of the changes. So you barely remember what you discussed last session. And the third problem is that you go 2 steps forward and 3 steps backwards, because you may make some changes, but then you have a fight during the week and you end up going backwards in some way. So the idea of a marital retreat is you take advantage of the vacation. You know, when you go on vacation, how you end up feeling more yourself, and the two of you feel so damn close because you spent a week together, 24 hours, 7 days a week, without a lot of work and kids and necessarily interference many times. Well, the advantage is that you get 3 hours a day in therapy and work on your relationship, and then you get a chance to practice some of the things that you're learning and, you know, set up some new habits. And so our experience is that it works, and that it takes much more time and effort. If you think about it, if you go to therapy an hour a week, you know, it's 20 hours. Here, 3 hours over a 10-day period is 30 hours. That's almost a year's worth of therapy, and then you get the other 10 hours a day to practice it. You can't beat that. So we find that people do remarkable changes in this period of time, and they're surprised when they go home how different their relationship is, and then we follow them up and try to maintain it in some way.
You can tell that Mark's the more pragmatic of the two of us. I'm the more emotional. And in conjunction with that, I'm going to appeal to your emotions. When you think, oh my God, I'm going to be with this person 24 hours a day, 7 days a week, and you feel nothing but dread, let me reassure you that it doesn't really work that way. The accumulation that comes from day-to-day life and the disappointment that comes from all of the times that you tried to resolve things with one another and failed, and sometimes failed miserably, and all the times when you don't even try to resolve things because you have enough problems to deal with that week, all of that begins to actually fade when you do have the time to put in focusing on the relationship. And what tends to happen is that you're able to renew the feeling that you once felt. You're able to renew that feeling of love and acceptance and empathy, instead of blaming and instead of worrying secretly that maybe it is you. No, it's them. But maybe it is you. I mean, these are the things that people think. So even if your relationship has become something that you think is irreparable, it's not necessarily so. A couple that really had passion and love and understanding originally can typically get it back, but there needs to be the intensity and the focus. There needs to be the depth too, because it's not just that you're bad at communication, although you may be bad at communication, but there are many things that factor into that, not the least of which is old patterns seeping in from major attachment relationships that started before you ever fell in love the first time and before you fell in love with this person. So people both have to work in the here and now, learning new skills, learning new ways of interacting, new ways of communicating. People have to work in the past as well, both renewing what they felt once for one another originally, and then looking at how things that were unresolved previously seeped into this relationship with the person that they never imagined they would have this problem and these issues with. There's nothing worse than the feeling of going to dinner and having a lovely dinner at a lovely restaurant, at a lovely table, and having absolutely nothing to say to the person you're sitting across who once was the love of your life. And the reason you have nothing to say is because everything that you can think to say is just like a minefield and will implode that table. It doesn't have to be that way. Come to Monterey.
You may be a bit skeptical, but having done this for 30-some years, we find that even couples who are fighting on a regular basis or feel like they're ready for a divorce, a lot of new energy can be brought into the relationship. I think that one thing I've learned over the years is that many times the problems the couple think they have are not really their problem. They may think that anger is the problem, or they may think that we don't have fun with each other, or we're bad communicators. All those are problems, but the problem oftentimes have to do with things from the past that are reenacting or repeating themselves into the present, and what we call intimacy disorder. And intimacy disorder are people who have difficulty connecting on an ongoing basis. They use kids and work as a way of sort of pulling back from the relationship. And so what we do is I work with the man and Lori works with the woman, or if it's a same-sex couple, one of us works with each partner, and we do individual work with that person with a partner in the room for an hour a day. It's very intense and opens the person up and facilitates intimacy because, oftentimes you learn things about your partner that you never knew before, and then you leave the session and you talk about it for an hour or two and you feel closer than you've ever felt before. And then the next day Lori might work with the other partner in an intensive kind of format. And then we also work on changing communication patterns, problem solving, anger management, all the things that you think of in a relational therapy. So you work at a behavioral level, but you also work at a much deeper level on the issues from childhood, adolescence, and through life in general that might have affected the individual.
I'll tell you a secret or two. One is, couples often feel as though they've grown apart and perhaps they don't even have the same values they thought they once shared. Could that be true? Is that what always happens? Is that inevitable? An interesting thing that happens in relationships is that as couples aren't able to work out small problems and they accumulate, the partners begin to feel as though they're on opposite sides of things. That's called polarization, and it often happens in any relationship where two sides of an issue are not getting adequately represented and thought through, and where people begin to then adhere to one side of the issue and the other person takes the other side. It's like tug of war. So I throw Mark the end of the rope and I say, I'm pulling this way, and he says, well, the hell with that, then I'll pull this way, just to balance you out. And in that way, couples become sort of artificially polarized around an issue that they may in fact see ultimately, inevitably, deeply in quite the same way. That was really too many words, but you know what I'm saying. So polarization is one thing that makes a lot of relationships that are in difficult straits feel as though they're just hopeless when they're not in fact.
So, if you've ever been to Carmel or Monterey, it's a wonderful place. It's the most beautiful place on the planet, actually. And we have everything here. You can do hiking, you can do golf, you can do sea mammals, you can do whales, you can have the ocean. It's just natural beauty, and being able to spend 7 or 8 hours a day in this natural beauty really helps. And so we give you homework assignments each day, and you practice them for a couple hours during the day, and we do some reading, and all that works to be able to further facilitate the change process. The thing you might wonder is, if it may work while you're here, but does it really carry over when you go home? So what we like to do is follow people up, usually by Skype, and have sessions where we can pull the threads through and make sure that you're practicing what you learned here with the addition of the stresses and work and so on. And what we do find is it generalizes out and relationships get remarkably better.
Let's talk about sex, but only briefly. Often when a couple is having distance in their relationship and conflict that never gets resolved, the sexual relationship becomes de-eroticized and not much is going on. Or if there's still a lot going on sexually, you wonder why, because so much has to be bypassed in order to have it. So we also are rather skilled in dealing with couples with sexual issues and sexual dysfunction even. So we have you covered in that realm as well. You know, I remember the days when the most common presenting problem was erectile dysfunction, but now everyone just sort of pops a pill and that doesn't seem to be the issue anymore. But nowadays we're having sort of legion numbers of people who have inhibited sexual desire. So more people are having more sex, but being less excited about it. And those are things that we also tend to in the course of working on the relationship with you here.
While you're bringing that up, I'll add that a lot of couples come in with psychiatric problems. You know, the biggest problem is depression these days. And so we have a psychiatrist that we work with who helps with medication, and we also work with the anxiety or depressive disorder. Also a lot of addictions. You know, it's fairly endemic in the population. And you know, an addiction is really a preoccupied experience that takes you away from intimacy. So we work a lot with addictions also. Well, we're going to end at this point. Let me just say thank you for listening, and we hope you'll consider coming to Carmel. And if you have any questions, feel free to call us directly, and either of us would be glad to talk with you at any time. Thank you.